from this fellowship, I'm now better equipped to use our on-the-ground work to change both federal and state policies. I understand how the process works, how relationships are built in these offices, which committees they go through, the different tools that you use to change, everything from a bill to oversight to appropriations to speeches. There's a whole range of tools.
I did go back and I taught food and nutrition policy at UC Berkeley to multiple years of students. And they really appreciated that I had been in the place that I was and I understood things, in a way that almost nobody really can, with an eye to what does this look like or what does this matter in terms of what the federal policy is and how do we try to communicate it better so that all the work can be effective? What are the right questions to ask?
You have to start with that policy or that vision of something that's important and good. And how do you then go from a dream to reality? Part of that is working with relationships. It's understanding resources and financing. And it's understanding that relationships matter.
I learned how to bridge differences in opinion to try to help come up with both to be responsive to those and listen to it and adapt, but be able to come up with agreement, which is not easy to do. Yeah.
You have to look to ways to build consensus, and how can you help bring consensus along? In other words, when you're at a stalemate and you're having a difficult time trying to bring a team together, it opened me up to looking at things differently and trying to learn more about leadership and how to build consensus with that.
What you're doing is taking people who have generally advanced degrees in some form of health or something related to health, and you're really educating them about the both political and policy process. And it's something that would be next to impossible to learn in another way. I mean, you could read it in a book, but you would never really see it. So that's one piece of it. But then you can also have an influence on policy, and you can learn how advocacy works. You can learn how policies are formed, how are they framed, what are the negotiations that people go through. And so learning about the whole process is pretty valuable if you're going to have any kind of impact on other policies that influence health once you leave.